Who can I talk to about my anxiety? That is a really important question that a lot of people ask. Anxiety is something that you might experience over the course of your lifetime. It might really feel like something that is just a big part of your lived experience. Maybe it feels like something you inherited, or maybe there's been a lot of anxiety in your household, so it's something that's felt very common. For other people, anxiety really feels more time specific. You're going through something that's stressful in your life, it brings up anxiety. You want to know how to deal with it and who you can talk to about your anxiety. So there's a couple of ways of thinking about this. The first way is to just sort of think about where you would probably go first for talking about your anxiety. And I think a big question that people have is what happens when you go to the doctor for anxiety? Essentially, how do doctors diagnose anxiety? And really, what doctors do, and in this case, we're usually talking about your primary care physician, the person that you would see for a range of physical medical issues, but that might also overlap with psychological issues. So, usually, a primary care doctor is going to be looking for physiological symptoms of anxiety, as well as worries, rumination, anything that's of a more cognitive or emotional kind of expression of anxiety. In particular, there are a couple of things that doctors look for. They look for the physical expressions of anxiety, and that might be seen through panic attacks, that might be seen through physical expressions of phobias, which are real specific issues of anxiety that people worry about. Some common phobias are things like insect phobia, animal phobia, getting like an injection or your blood drawn. These are all real specific types of things that people get anxious about. There are also much more sort of generalized anxiety worries that people have. And this is, I would sort of describe this as like a really overactive mind where you're worrying about a lot of topics. It's not one specific thing in particular. But doctors look for the physical expressions of that. It might be physical symptoms of anxiety, such as a racing heart, facial sweating, facial blushing. Those are kind of some big ones. Also, you might have like GI symptoms, like a kind of upset, worried stomach that's an expression of your anxiety. Those are kind of the big ones that jump out to doctors. Doctors also look for more specific kind of expressions of anxiety. So for people who have OCD or OCD-like symptoms, they're looking for obsessions or worries or ruminations that you might have trouble letting go of, or more kind of compulsive, repetitive behavior. Sometimes people may have anxiety that crops up around social interactions, interpersonal anxiety. So doctors will also be trying to assess where is that anxiety popping up in your life. So that's really the first wave of kind of how anxiety gets treated. A lot of people who don't have experience dealing with anxiety will go to their doctors for that first wave assessment. And at that point, the doctors might recommend an anti-anxiolytic medication. These are some common medications that people are familiar with, like Ativan, Xanax, Valium, or they might recommend an off-label use of an antidepressant or SSRI for anxiety use. These are drugs like Paxil, Prozac, Lexapro. Let me be clear, I am a psychologist, a PhD. I'm not an MD, so this video is not about endorsing medications for use of anxiety. I'm just trying to explain one way that doctors will treat or address anxiety. Now, another way, which I think in some ways I recommend as being equally, if not more important, is what's known as psychotherapy or therapy. And that's when you actually go and talk to somebody about your anxiety issues. If you see a PCP, a primary care physician, or a general doctor, they'll usually make a referral or a recommendation to a therapist. And a therapist is a general term for anyone that you can talk to in counseling or therapy about your particular issue. There are licensed professional counselors, licensed clinical social workers, and psychologists. I'm a psychologist, and psychologists usually have the most training of therapists. They've completed a doctoral degree. They specialize in particular areas. If they work with anxiety, they have a lot of training in assessing anxiety and treating anxiety. I actually have another video on our channel page that talks to you about 3 specifically endorsed types of therapeutic treatment for anxiety. But just a quick summary, this would be things like CBT, cognitive behavioral therapy. Exposure therapy is a type of CBT treatment that's often used to address specific anxiety symptoms that are happening when somebody is avoiding something that made them anxious and it's causing the anxiety to persist. Sometimes therapists will work with particular thought patterns that get to the root of anxiety to try to help people make changes. I'm interested in particular in an area called psychodynamic treatment of anxiety, which really looks at some of the origins or root causes of anxiety. A lot of times people are focused more on addressing the specific anxiety symptoms, the physical anxiety symptoms. They're thinking to themselves, how do I fix this? And while that's really important, and there are some wonderful techniques that you can learn in therapy to better manage your anxiety symptoms, it's also sometimes really important to try to get to some of the root causes of that anxiety. Otherwise, you're kind of in a situation where you're playing a bit of whack-a-mole. You're addressing one specific anxiety symptom or presentation. Maybe it's the headache, maybe it's the upset stomach, maybe it's the racing heart rate, but then the anxiety pops up in a different way. Maybe you're worried about one thing, you get that under control, and then the worry pops up in a different way. So we really try to look at some of the underlying issues behind the anxiety symptoms so that we can really get to the heart of the matter about why you specifically are having anxiety. And I think a great way of thinking about this is, instead of saying to yourself, how can I fix my anxiety? You might say to yourself, how can I change my relationship with my anxiety? So that's it here, folks. This video has been all about who you can talk to about your anxiety. To get more information about anxiety, how anxiety is treated, check out our website, which is www.therapistsinphiladelphia.com. Again, that's www.therapistsinphiladelphia.com. I'm Eric Spiegel, the practice director here at Attune Philadelphia Therapy Group, and thanks for checking out this video about anxiety.